Okay, this is Miss G, and she's going to tell us a little bit about her situation. And go ahead.
3 years ago, I had a neurostimulator implant put to control my pain by electricity. I had enormous pain in my lower spine and both legs and feet. And that stimulator has worked well, but it has left me with all kinds of other pain that I have. I woke up from surgery with it, and I've tried to find a solution for it for 3 years. I have gone to the best doctors I thought were available in the Dallas, Texas area. I went to the medical school. I tried everything they suggested, all kinds of medication. I was tested for every possible thing that exists, and nobody could help me with the pain. Nothing they did would take the pain away. Likewise, the left side of my face and ear became bright red and flaming hot, and nobody could get it under control.
Now, so the trigeminal, they call that trigeminal neuralgia, did they?
Yes,
Now, actually, today your left ear seems to be a little bit red. So,
yes.
what did they offer you?
What did it?
No, what did they just offered you medications?
They offered me medication. They did some trigger point injections, which did not work for me. They had me use a lidoderm patch, and I used it for some months, but then it began to burn my skin so badly that I couldn't use it anymore. And basically, I became a practical invalid, handicapped from the medications. They were too strong. I was using tramadol, I was using Klonopin, I was using Clonidine, I was using extended release and regular. I was trying everything they suggested, and all that was happening to me is I was becoming a handicapped person walking around with a cane and a walker. And I became overwhelmed with, I would say, anxiety that I wasn't going to be able to take care of myself, living alone and being independent. And a friend of mine suggested I talk with his wife, who was a nurse in a pain management clinic. And I did that, and she's the one who alerted me to what she called reflex sympathetic dystrophy, or chronic pain syndrome.
Okay.
And told me about it, and said there was a foundation in Connecticut that was devoted to helping people with this. And I contacted them and asked them if they could send me literature and a list of doctors in Texas who might be knowledgeable and I could go to speak to. And when that list came, I saw that Dr. Stephen Rodrigues' name was on the list, and he had helped me years ago when I had migraines. And so I decided to come back and see what he could do for me. And that's 5 weeks ago now. And in 5 weeks, I feel like I'm a whole different person already. I'm not cured, and I don't expect to be cured, but I am, my quality of life has improved dramatically. My energy level has increased. I'm able to get out and about ever so much more. No cane, no walker.
Pain level from the nerve in your.
Yes, with needlework, deep needlework. I don't know the name of it all, but all the acupuncture, but other deep needlework has, for about 3 straight weeks now, taken away that terrible burning in my face and ear. It has come back the last few days, but I kind of expect that it's going to recur and we'll have to keep being treated. But the relief from it is unbelievable, because I can sit with an ice pack for a half hour on my face and I take it off and nothing has changed. The cold doesn't touch the heat at all, it doesn't relieve it at all. Only the needlework seems to do that, or whatever it is that Dr. Rodrigues is doing. The other thing is that I woke up from the implant surgery with pain, severe sharp pain to the right of that incision. And no one has been able to get rid of it. They kept telling me that they had cut through muscle and tissue and nerve and that it would heal itself in time. Well, in 3 years it has gotten steadily worse. It has not gotten any better. And through a lot of trigger point injections, using, I think, small amounts of lidocaine and cortisone and other things in there too, the relief I have felt in the last 10 days is remarkable. My back is still tender and sore, but there's no longer sharp pain that takes my breath away, and that causes me to have to sit quickly because I can't even stand the pain. So I know that I am getting better from this, and I'm going to follow through with it and see how far, it can get me.
Now, the people at the other physicians, the people at UT Southwestern, never really suggested needlework.
They suggested trigger point injections after, as a last resort, after they had tried endless other things.
Okay. Now, they had done the trigger points, but they didn't have the results.
No, there were no results. I got maybe 2 or 3 days of a little relief, but nothing at all significant.
Okay.
And they would only give them to me every 3 months, and so 3
see,
days in 3 months, it was, wasn't worth going. It wasn't worth going for them.
Okay, thank you very much.